that, and she had a whole host of medical problems, which is why I was seeing her. And when that came to light, my patient did tell me at the time that she wanted to go into recovery. So I said, okay, let's look into that, because I'd never been in a situation where I had to actively help someone to go to rehab. So, of course, I said, let me call her insurance. So I did call her insurance, and I found that, wow, there was like all this red tape. And with that, I was like, well, are they really promoting recovery? I wasn't really, in my mind, I wasn't really feeling that sense. You know what I mean?
Oh, yeah, certainly.
And so it got me thinking about it, and which is where you come in, because I know that you work at a facility within healthcare that caters to dual diagnosis. And for those people that don't know, Randy, can you tell us a little bit about what dual diagnosis is?
So dual diagnosis is primarily for those that are dealing with a substance abuse issue, and secondarily, they also have a mental health issue where that could pertain to depression, schizophrenia, bipolar disorder, all sorts of any sort of mental disorders, including visual and audio hallucinations as well.
Mm-hmm. And you deal with people that come in with substance abuse related issues, correct?
Oh yeah. I would say on a monthly basis, we can have anywhere between, I would say, 7 to 10 patients that come in with a substance abuse issue currently, or with a history of.
Yeah. That's a lot. And with that in mind, what's the way that I want to phrase it? How, like, in healthcare, we have this term frequent flyer, so I want our listeners to kind of understand what that means.
Yeah.
But a frequent flyer is basically someone that you know very well because they've been within the system many times. Yeah. So how often would you say, in your opinion, just like a ballpark figure, how many times